My name's Jess Paranella. I'm a registered nurse at Magee Women's Hospital. I work on the mother-baby unit, and I'm here to talk about nursing for the Career Spotlights.
I'm Luann Cook. I'm a certified registered nurse anesthetist, and I'm here to speak on advanced nursing careers and advanced practice nurses. Jess is going to start off talking about her nursing experience, and then I'll talk about some advanced nursing careers.
Okay, so I graduated from Bethel in 2009, and I went straight to school. I went to Pitt for my bachelor's degree, so I graduated from Pitt in the spring of 2013. And after you go through nursing school, you have to take something called the NCLEX, which is basically like a giant test that you have to take to get your license. So I took that in June, and then I started at Magee. I work at Magee Women's Hospital at the beginning of July. So I work at Magee. I started there, like I said, right after I graduated school. I work on the mother-baby unit, so I take care of the moms once they deliver, and then the new babies while they're in the hospital before they go home. So I've been there for almost a year and a half, and I really like it. There's lots of babies being born.
We have those handouts. We should probably get those out because it has some.
I'm fortunate that
Yeah.
I got one right out of school, and something that I liked, and something that they'll always need nurses for. So I guess I know we asked our questions at the end, but does anyone have any questions about like anything from college or like anything getting into school?
Well, I will tell you that there is a projected job shortage of nurses coming up, and there's by I think it was like 2020 or something like that. There was going to be a 20% job shortage of nurses. So as far as job outlooks go, it's a great career. You'll definitely have a job after you get out of school, and it's.
Should proceed to the auditorium for the program. Thank you.
And it's something that you can use throughout your entire life. You can have a full-time career, you can have a part-time career depending upon your needs. You can work just weekends, you can work during the week, night shifts, whatever you want. But it's something that you'll be using in your family life also. You'll know how to take care of your kids, your parents as they get elderly. It's a great career. And there's so many pathways that you can take once you get out of graduate from your nursing program. You
don't have to just work in a hospital. There's
right.
so many places you could work in different jobs, and you could be a staff nurse on the floor at a hospital, or there's nursing homes and there's different facilities, and not to mention there's an informatics nurse. I don't know if you know what that means, but basically like she'll come around and she works a lot with us with our charting in the computer, like the programs we use to doctor and stuff. So that doesn't necessarily seem like a nursing job, but nurses work on that because you need a nurse to kind of help you figure that out. Because if it was just left up to engineers, they're not the ones that are using it in the end, so they need nurses' inputs too. So that's just an example, but there's so many different pathways you can go on with nursing. That was a reason why I chose it, because there's so much you could do with that degree.
Tina?
You said you graduated from Pitt.
Mm-hmm.
Like, what type of classes did you do, like, through, like, from your first year of college to, like, your last?
So, like, when I first started, most of my classes, they weren't really nursing classes. Like, I took chemistry, I took psychology, I took sociology, kind of just, like, I had anatomy, basically just, like, a bunch of, like, basic classes. And then once I started my clinical my sophomore year. So I started my clinical rotations in the hospital, and then you had more in-depth to nursing, like a pathophysiology class or microbiology or pharmacology. That's when we learn all the drugs and everything about them. So it kind of got more specific as you got to the end of college. So in the beginning, it was just kind of generic, but it kind of got more specific as it went on.
Most of the schools have what they call block schedule for nurses. So after your freshman year where you do like your core requirements, then essentially you're just in that university school of nursing. And so like this semester you're studying this,
Yeah,
like
you don't
med
really get to
surg
pick your
schedule. It's kind of,
already,
they just progress you
set
right
for
through,
you,
you know, and
yeah.
you just go from one specialty to the next specialty to the next specialty. So you have the opportunity to pick a few electives on your own, but it's really kind of a set curriculum because they have to cover certain amount of material and to make sure that you can all sit for the same test. Okay?
And a lot of places now, you don't have to go for a 4-year degree. There's other options. You could get an associate's degree. But a lot of places, like I know McGee, and I don't know if it's UPMC wide, or I think a lot of places are starting to only hire if you have a bachelor's degree, or if maybe you have a different degree but you're currently going back to school for a bachelor's degree. So there are, and the people that are already working that don't have bachelor's degrees, they're kind of, I don't want to say getting forced, but kind of
Yeah.
strongly encouraged to go back to get their bachelor's degree. So you don't have to go to a 4-year program, but it's kind of strongly encouraged, and you'd have to go back anyways at some point probably.
So I have a friend that went to CCAC for
Mhm.
2 years.
Mhm.
I guess that you come out with your RN.
An RN,
Mhm.
yeah.
And so she's currently working at St. Clair Hospital. So would that mean that she would have to go back, or she would risk losing her job, or that it's just highly recommended?
At this time, all students on the second floor, please
It
report to the
depends
auditorium.
where you
Thank
work. I mean,
Mhm.
like there's people that I work with that went, that went to CCAC, and that's an associate's.
Mhm. Yeah.
So, I mean, they're working and everything's fine, but they are being kind of strongly encouraged to go back to get their bachelor's degree.
And the nice thing about it is some of the hospitals will pay for you to go
I
back
was
to
gonna say,
school.
yeah, and there's an increase in pay. Like I think it's
Yeah,
like
most of the
$1 or
time,
$2
that's-
more if
that's
you
the
have your
incentive
bachelor's
degree.
You get paid per hour also.
Is the reason like you just need more education? They want the nurses to have the bachelor's degree for
Yes.
more advanced
Right, because most of the nursing specialties now are going to doctorate levels, so your entry levels have to be, they prefer to be like a
Right.
bachelor's, which is, and that's why.
Okay, but they can still
and-
go to CCAC for
oh,
free
absolutely.
and then transfer into a 4-year school.
Absolutely,
Right.
yeah, and then CCAC has a great program, they
Okay.
do. But I mean, just know that, you'll probably be going on even
Yeah.
after that. But, yeah. Another thing that you want to consider is like the courses that you're taking now in school. Of course, once you get into college, it'll be a review again, but it would be to your advantage to take an anatomy and physiology class here, perhaps a general chemistry class, a physics class. Those are all classes that you'll be required to take. I know some people say that, it's not part of being a nurse, but it all does come together. We use science a lot in our job. And, but we also, you might want to take a psychology course. So we do a lot of teaching. We interact with people all the time. And so you have to be able to be a person who wants to talk to people and can talk to people easily because, if you don't like people, don't go into nursing because that's
Yeah.
won't be for you. Yeah.
Since like science is like changing and everything's always changing in the science field, like what do you nurses do to like stay updated? Does it like take like tests and stuff?
Well, we always have like continuing ed, and we have like educational days like within our units. And then
we do have to renew our license every so many years too. So with that, that's what she was talking about, the continuing ed. There's like, I don't want to say classes, but like
Kind of
like
yeah.
classes that you can go to and sit through, and then you print out like a little certificate, and then you have to keep that when you renew your license. But like once you have a job, it's more so doctored to what you're doing. So like I'm learning new and upcoming things about, postpartum mothers or, newborns in the first couple of days of life, whereas that's probably not
yeah, I'm
what
not.
you're looking
Yeah, I'm
at.
not looking at that.
And I'm not looking at stuff that she's being taught. You know what I mean?
Yeah.
Like I'm not learning about, mental health issues necessarily because I don't really deal with that as much. But it's kind of doctored a little bit more to what specific area you're in.
But it is ongoing. Just know that, like, once you graduate, you know, your education is not done. But it's more low-keyed, it's more laid back. It's like an in-service type thing, but initially, everyone's education is the same. I do want to mention, we talked about it last year too, a lot of the programs that you can get into that your education will be fully funded is through the armed services. And so like the Navy, the Army, Air Force, those, of course you owe them time, you know, when you get out, but it's also great experience. And if you're accepted into those programs, and they are competitive now to get into, it's a great experience. And the whole thing is taken care of, but
And
you
this is
owe,
for all students on the third floor.
them time.
Or
Would those
to
be
the
the
auditorium.
ROTC
Thank you.
programs, or are there other
There
programs?
are some ROTC programs, but you can, you have to contact your recruiter to see, like, you know, as far as, because they have certain schools that they would like you to go to. And you do ROTC or some form of it while you're in school, you know, to start to give back your time. But that's something to consider if finances are a problem. They're really good as far as advancement too, and for pushing their nurses to get advanced degrees. It's all taken care of by those services.
So it's like you would go to school for, let's say, 4 years, and then you would owe them 4
Right.
years of service.
Right.
And-
Like for some of the people I graduated with, they became Navy nurses, and when we graduated from Pitt, they went to San Diego. They were assigned there for a year. Then they had a tour overseas. They were in Spain for a year. It was all part of their payback commitment. And then they retired from the service at the age of 55, you know, done, because they had put their 20 years in, or even more. But it was all taken care of. I want to talk to you now about some characteristics that you need to look at yourself to see if nursing is really for you. You have to be a compassionate person. You have to really care about other people. You have to not to be afraid to want to touch people. If you're someone who can't hug a person or embrace a person, or you pull back if someone does that to you, then perhaps this isn't the profession for you. You also have to be very detail-oriented and have good organizational skills. Your day goes quickly. You're taking care of a lot of people.
And
You
it
have
never goes the way you planned.
right, and you have to be able to prioritize, like who's your most important patient, or what's the most critical thing that you have to do to start your day. So if you can do that, then that's good. You have to be emotionally stable. I mean, there are days that you think, what am I doing here? I can't. That goes with any job, but sometimes all the emotions that go with taking care of human beings can get to you. People are going to die on you, and you're there when people are born, and you're there when people get better, and you're there when they get bad news that they have cancer and they're not going to live for 6 months. And you have to be able to stand there and like help them, you know, to cope. But you have to be strong yourself emotionally to get through that. So if you're that kind of person, or you think you're going to be that kind of person, then nursing is for you.
You have the patient, and you also have the family that goes along with them too, that sometimes people forget that you're not just kind of caring for the patient, you also have mom and dad,
Right.
and grandma, or, you know, sons and daughters, or whoever else that you're also helping through, you know, whether it's bad news or good news that you're giving them.
Mm-hmm. And then along with that, I mean, there is a physical aspect of you are physically taking care of people. I mean, you're giving them a bath. You're changing their dressings. You're helping them to walk. You're helping them to go to the bathroom. And initially, I mean, when I was a teenager, I didn't think I could do it either. But it comes with the job, and we don't think anything of it. I mean, that's just what we do. But I mean, if you think you can do that, then nursing's for you. Let's see what else.
I guess I can talk a little bit about the hours that you work. A lot of places, some places that you have to work strictly 12-hour shifts. You'd work 7 to 7. I know the NICU at McGee, they have a bunch of different shifts, like 3 p.m. to 3 a.m. or vice versa, or
At
7
this
to
time,
7.
students on the fourth floor, please report to the auditorium. Thank you.
Sometimes some places have 8-hour shifts where you'd work maybe 7 in the morning to 3 in the afternoon, or 3 to 11, or overnight 11 to 7. I personally, I work 3 12-hour shifts every week, so I do 7 to 7, either daylight or night shift, and they rotate. So unfortunately, they're not blocked together where I do all daylights and all nights. They're kind of random and sporadic, so it takes up a little bit more time than you would think by thinking, oh, you're working 3 days and you have 4 days off, but part of those 4 days are spent sleeping after your night shift or before you have to go into work. But
You do work holidays,
Weekends.
Weekends. Somebody has to take care of those patients. The good thing is you're well compensated for it. So if you're working a holiday, you're making either time and a half or a double time. So usually in the hospital, it's not hard to get it's not hard for them to get covered because it pays so well. Same thing with the off tours, like if you're working 3 to 11 or 11 to 7, you get additional money for working that because it's not normal working hours. So, I mean, you can make a pretty decent income. What's starting for a nurse coming out?
$23, $24 an hour.
Which works out to be about anywhere from $45,000 to $50,000 a year. That's entry level. After you work for a couple of years, you progressively get, raises, increases, and if you get advanced degrees, then of course then you get a pay increase with all of that. So I mean, I know I worked at Allegheny General. Some of the RNs, they were making like $60 an hour working in a trauma unit. But I mean, that's intense physically and emotionally. Right, and they'd been there for a long time, but I mean, it's good money, but you're working, hard for it. Just now. I'll tell you a little bit about what I do. I'm a nurse anesthetist. I put people to sleep in an operating room. I started out, I'm a Pitt grad also, and I worked for a couple of years at Allegheny General as a surgical nurse, and then I worked in ICU in coronary, and then I got into anesthesia school, which when I went, was a 2-year program, full-time. Now it's 3 years and you come out with your doctorate. I went back to Allegheny General to work as a nurse anesthetist. I also flew on life flight as part of the anesthesia requirements at that time. Now and that was before flight nurses really came into being. Once some of the nurses started coming out of the military who were flight nurses, then they started taking those positions on the life flight helicopters. And so primarily that's who you'll see flying. Those flight nurses usually have some kind of military background or emergency room background, which is what you need to be a life flight nurse. So I work in all the specialties. I put kids to sleep, adults to sleep, elderly people to sleep, I do OB, general surgery, whether it be like your gallbladder or your appendix. For the kids, we operate on their eyes. Some of them need work to be put to sleep for their teeth. Whatever the surgeons have. I also give anesthesia for a lot of plastic surgery. So that's kind of what I do. And it's been a great career. The only time I really doubted myself when it was like 4 o'clock in the morning and I had already been up over 24 hours on call. And you think, what am I doing? But it's like I love it.
It's very rewarding.
Yeah.
I love it.
But there's other things that you can do as advanced nurses. You can become a nurse practitioner, and they work alongside a physician and under his supervision, and they see their own patients, write their own scripts. They practically now, and they're getting an expanded role with the changes in healthcare that are coming along. So we see nurse practitioners, their role really expanding. They're very similar to physician's assistants. It's just that their licensure is different, but it's pretty much the same thing.
Is it additional 2 or 3 years now?
Nurse practitioner probably 2.
I know Pitt, they're making it 4. It used to be a master's program, and they're making it into a doctorate.
Yeah.
So if you went full-time, you could probably get done in 3, but
Yeah.
like a lot of people that are going back for that are still working. So it's like you can't work full-time and go to school full-time, so it's going to take a little bit longer.
So
But
if you guys understand, you have to get your bachelor's degree first, and then
Right.
these advanced nursing careers, you
Right.
go back. and it used to be a master's degree for a lot of them, but now it's 3
Yeah.
or 4 years additional, but the compensation is excellent, and you can even talk to them a little bit about that, maybe.
Right.
Yeah, you do have to specialize though too, and that's my biggest thing why I haven't gone back. I've kind of always had nurse practitioner in the back of my mind, but you do have to kind of pick a specialty. So like there's neonatal nurse practitioners, that would be like with the babies. There's a pediatric nurse practitioner with kids. There's a family nurse practitioner. That's a little bit more
Yeah,
broad, and a lot
broad.
of my friends that are going back for that, because it's not as specific. And you know, there's programs that you can go on to get that degree right after you get your bachelor's degree. Personally, I wanted to work a little bit to find out what I wanted to do, because I didn't want to get stuck in a field and, you know, oh, I like babies, I'll go into this, and then, oh, what if I want to work with children? Well, I can't with the degree that I have now if I, you know, kind of went too far with that. So my suggestion would be kind of to figure out what you want to do first before you would go on to that. But a nurse practitioner isn't the only option. You know, you have anesthesia.
Right.
There's different education degrees you could get that are still 2-year degrees that you could, you know, be a clinical instructor or some sort of
Right.
education.
Like you can go back and teach nursing, but now, because most of them are like, you'd at least have to have your master's to teach, if not your doctorate. There's a couple new fields that are coming out. There's forensic nursing that is starting to get a little popular. A lot of people become nurse attorneys. They do malpractice cases. So they know how to read those charts. They know what should have happened to that patient and what didn't happen to that patient. So, you know, that's an option too. Of course, it's law school after nursing school, but you're well compensated for it.
You all know what malpractice is? Yeah? Anybody not? Okay. Maybe you could explain what that is.
Malpractice is when, like, a patient comes in for a procedure and they have a bad outcome or something goes wrong. And so we are all insured that so the patients, maybe the patient and the patient's family would sue us because they felt that they weren't taken care of correctly. So you carry insurance to help pay for that, and, you know, for those court costs or those legal costs. That's what malpractice insurance is all about. So does that explain it a little bit?
Yeah, exactly. If something goes wrong, you can be a nurse to make sure, and a lawyer at the same time,
Right.
to make sure that you all did your job correctly.
Right.
Okay.
Yes.
What would be the difference between like an anesthesiologist and a nurse anesthetist?
Well, I will tell you that initially it's another zero in your salary, which, you know, now makes it, but the difference is that an anesthesiologist goes to medical school and does 4 years of residency. A nurse anesthetist, we go to nursing school and we do like a 3-year program. I practice solo, sometimes without a physician supervising me. If I'm in a hospital, by the state of Pennsylvania, there has to be a supervising anesthesiologist. Are they in the operating room with you? No, I am, putting you to sleep. If I run into a problem or think I need help, I call an anesthesiologist. You can go to Ohio, they don't need anesthesiologists at all. The nurse anesthetists they just run the operating room or do the, you know, put the people to sleep. It just depends on which state that you're in. So the anesthesiologist, and I have worked with some wonderful anesthesiologists, but they have, you know, they certainly have put a lot more time into their education. They're usually more in academic settings like UPMC, those kinds of the big centers where there's a lot of trauma, a lot of hearts, where they do like a lot of neuro cases, those kinds of things. But they have also, when they come out of med school, they have invested, they're coming out like $250,000 in debt, you know, for their education. So now if you're coming out of anesthesia school, you're coming out $100,000 in debt. The difference of about $150,000. Then probably will only go up as the years go on, but that's, yeah. I think it might be mine, I'm sorry. Get detention.
With a nurse anesthetist, what would the starting salary range be? I know it might be different.
Okay, starting salary for nurse anesthetists is around $120,000 coming out. but you know, you've given up 3 years. You're $100,000 in debt. So it's a while before you ever realize that income coming in by the time you pay your school loans off. Yeah. So, and you do, and along with that, while you're in school, you're also taking out loans to live. So, I mean, because you can only work so many hours, you know.
Does being an anesthesiologist as opposed to a nurse anesthetist make a difference in how quickly you get a job when you come out of college?
No.
No.
Mm-mm. Actually, not because I'm a nurse anesthetist, but because we're cheaper, hospitals are picking us up. You know, because like for the supervision ratios that are mandated by law, you can have one anesthesiologist supervising 4 anesthetists. So a hospital, anesthesiologists coming out, their starting salary is $400,000. So you can get essentially 4 nurse anesthetists to do the same thing that one anesthesiologist can do. And that's, it all boils down to the bottom line in economics when these hospitals are looking at it. And they're going to go with they can get 4 instead of 1 unless they really need 1. And I'm not saying, I mean, there certainly is a need for anesthesiologists, and they're very good. But it's just, it's a shared turf.
Is it the same thing with the physician and the physician assistants as well?
Yeah,
because it's
pretty
cheaper
much.
to hire
Yeah.
a physician assistant than it would be
Right. And you'll see that there'll be like less physicians, but they'll be hiring more PAs in their
more
practice.
nurse practitioners.
Correct.
Yeah.
So they kind of just like,
You need bodies too, like you were saying, like you have one anesthesiologist, so they can only do so
one
much
operating
at
room,
one
whereas
time,
you can
you know.
you can have 4 operating rooms going,
Right.
you know, at the same time. Let me see what else. Any questions? It's not anything that any of you in this room that you can't do, believe me. And if you just persevere, you'll get through it.
Yeah.
I mean, it's just like any career. I mean, you know, nothing good comes easy. So, I mean, in the end,
It's difficult, but
yeah.
I mean, it's paid off.
You know, don't give up, don't quit, and but no matter what you choose, you know, just look at the people who are a year ahead of you. You know, the ones who are saying, "Oh, give up now," blah blah blah. Don't pay any attention to them. Just look at them and say, "You know what? If you can do it, I know I can do it." You know, and you'll see people trying to do that because initially in some of the nursing programs they have these huge classes where they are trying to like weed out the people to see like who's truly interested in, you know, who will be able to complete their program. So if you just hang in, it's like big chemistry classes, big bio classes. What else did we have that was big? Anatomy. And those are the ones where they're trying to sift the people out to see, like, you know, who's going to hang in there and do it and who's not.
And those are all classes that you can take here and get a good
Right,
foundation in
and get a
as
good
well.
foundation.
We have anatomy and physiology.
Mhm.
We have, you know, up through AP Chem, up through AP Bio. I don't know, do you do much with physics?
Yeah, we do.
Okay.
Hmm.
I had a little bit. Yeah.
So all of those, and math too, because you've got to calculate.
Right. Everything, like, for instance, everything I do is all the drugs that I give to keep people asleep are based on milligrams per kilogram. So I'm constantly figuring out, like, you know, how much to give them, what they need, that kind of thing. So, I mean, the science comes into it. I use gas to keep people asleep, so the physics comes into it. And I have to know, like, you know, the blood gas ratio of the patient and the patient's history and how their history affects what I give, because some drugs I can't give to certain patients. So it all comes full circle. When you're taking it separately, you think, why do I even need
Right.
this?
Yeah. Because it's not necessarily tailored to nursing. It's just
Yeah.
like a physics class, so you're kind of sitting there thinking, I'm not going to use any of this, but
Physics with like random like people that are in different majors too.
Yeah.
yeah, like the chemistry class like wasn't like nursing chemistry. It was
No.
like there were people in there that were on the pre-med track that were just taking like general, you know,
Or
chem,
it's like, and I had
physics,
like,
bio, all this
mine was
stuff.
with like chemical engineers
Right, yeah, yeah,
who were
that's
like
different
really
stuff.
into it, and we
Yeah.
were just like we
Why
were like
do
we're
I
like
need
nursing
this? Yeah.
students. Why do we even need, you know?
Yeah,
But
the first semester of college.
yeah, but it was, but it does all. You do use it. Wow.
What are the most challenging parts of the job, do you think?
You go first.
Because you work with the little tiny babies
Yeah.
that may be, right?
Yeah, for me, I think it's just there's times where I'm frustrated because I don't feel like necessarily I get enough time to spend with my patients. Like there's a lot of days where my job is very task oriented. There's certain things that need to be done at certain times, different testing on the babies when they're 24 hours old or they're 36 hours old, you know, they need a bath at this time, they need, you know, blood sugar done before they eat. Like there's a lot of just tasks that need to be done, and for me it's frustrating when, you know, people, you know, need you maybe to say help with breastfeeding, or they're just really frustrated about something, or you know, these women are hormonal and just had a baby and they're exhausted, so they maybe just need to like talk to you for 5 minutes, but sometimes I don't have 5 minutes. So it's, that to me is the worst part, when I feel like sometimes like I'm there, but I'm not there. Like they need me to be like, you know, certain days. So that to me is frustrating, and kind of like I touched before on the whole family aspect, that can get frustrating too, where you're trying to care for, you know, a mom and her baby, and grandma's, you know, standing over your shoulder, and everything you're doing, she's like, well, don't do that or do this, and it's like, hey, you can do this, or I can do this, but this isn't working right now, so and you can't, you know, nursing is kind of a job that my mom and I were talking about this. My dad's an engineer, and you know, if something's not right, you can kind of yell at someone and it'll get done the way it needs to get done. We can't do that. Like
Not
I
in
can't yell
nursing.
at someone and
Yeah.
say, you know, like I can't yell at a patient even
No.
if they're screaming at me for something that's out of my control or wasn't my fault. You kind of have to just like stand there and like let them yell at you, and then, okay, well, I'm sorry you feel that way, and then kind of like go on from there. So that's kind of a challenging part that you kind of adapt to, like just
Yeah.
your experiance. Like you
Do
can't
they
really
teach you
get
that
taught.
at all? Like,
I was just gonna
Oh,
say,
yeah.
I mean, they teach you it, but you're not, the first time it happens to you, you're gonna be like not knowing what to say.
Yeah,
and you kinda
it does take you
better at
back.
it
But I mean,
experience.
we have psych classes, and they teach us on, you
Yeah.
know, how to, and we do a lot of role playing in nursing school, where, you know, they put you in situations like how would you handle this. But it's like everything, it doesn't prepare you for the real world, you know, when someone's screaming at you. And it could be family, it can be a doctor screaming at you. It's just, but you're like, yeah, okay. And then, you know, but are you done? And then you try to make them understand either why the situation is what it is, or, you know, try to work with them as to how they think this would make it better for them.
Right, because they're probably not screaming at you. They're
No,
screaming
it's always the
Right,
situation.
right,
Yeah,
right.
but at the
But it
time,
gets taken out on us.
Yeah.
a
yes,
lot
it
of the time.
does. It does, and that just goes with the job.
Right.
Yeah, you get some pretty thick skin after a couple of years, huh?
What other questions do you all have?
Do you know if the Shadyside School for nursing is like good?
Yes,
Yeah.
it is a good
I was
program.
looking into it, but isn't it only 2 years?
I think that's 2 years.
Yeah, it's 2 years.
Don't you get a job with Mercy Hospital?
I don't know about that, but I mean, it's a good program. Shadyside Hospital's always had a good
Shadyside
program.
has a good program.
Good
Mercy-
program.
Mercy has a nursing school program.
Hmm.
That might be the one that you probably like would go through there, and then you'd work.
But look at both of them.
Yeah.
You know, look at all of them, and then
And we
and make-
have those students in our hospitals doing clinical. Like I've had Shadyside students or Mercy students kind of following me for the day, and
Mhm.
Do they make
Yeah,
as
that's-
much as you would since you like graduated from Pitt?
no,
No.
but it doesn't have to do with that I went to Pitt. It's just that I have a different degree than they'd have, because I have my bachelor's degree, and that would be an associate's degree.
Yeah.
So I'm just making more. And then, like I said, I touched on too, a lot of places are only, like I know my unit in particular is not hiring, they're not hiring like LPNs or
Yeah.
people with associate's degrees, licensed practical nurses. They're hiring people with bachelor's degrees. So it might be a little bit harder to find a job. But like you said, like if you go to maybe a nursing school at a hospital, part of that deal might be that
They'll pay
get
for you to
they
go.
You get a job, and then while you're at that job, they'll pay for you.
They'll
to
pay
kind of
for
go
you to
back and
get your degree.
bachelor's.
Yeah. Yes.
The nurses in the trauma center,
Mhm.
are most of them practitioners or just registered nurses?
No, they're registered nurses.
Mhm.
They can be, some of them are advanced practice nurses, like they get like a critical care certification, which is a big exam that you can study for and sit for. Again, you get like a slight increase in pay, but but in the trauma unit, it can be a mixture too. But most of them are regular nurses who have just progressed, you know, transferred from a regular floor to a unit, And when you transfer to these units, there's classes. I mean, you just don't become a trauma nurse. It's like 2 months of classes before you're even touching a patient
and
again
then
at the
probably
hospital.
months of orientation.
Orientation, yeah. So I mean, they just don't, let you go. So it's a long process because I mean, you're taking care of very critical patients. You may only have one patient or at the most 2 patients, but they're very,
Very, very sick.
very, very sick. Yeah. Yes.
Okay, so if you have your RN and if you're trying to get your bachelor's
Mhm.
degree, if it was in Pitt, would that take like around 2 years if you're like a full-time student?
To go from like your associate's degree to
Yeah.
like a bachelor's degree.
To a bachelor's degree.
Yeah. And a lot of
Probably.
the,
They have some like even like advanced. Trying to think.
like the RN to BSN
Yeah,
programs.
like
Like
different, like,
Duquesne
fast
has a
track
program
things.
like that, like a fast track. You can get it in a year.
Like a BSN.
Mm-hmm.
Mhm.
Mm-hmm.
Because I was talking to this guy in Pitt, and he's like, I would say that you should go to maybe CCAC and get your RN for 2 years because they have a two-year
Right.
program, and then get your BSN here for 2 years. And I was like, oh.
Yeah, you can do that.
You could do that.
I mean, it's more cost effective,
Yeah.
I mean, because
It's also like a very rigorous. Like it's a very
intense.
yeah, I guess that's the word I was looking for. An intense curriculum that you're doing because essentially you're kind of learning stuff that we have like throughout 4 years. Kind
Right.
Of
Crammed
crammed
into
into
2.
or a year and a half even. So
Right.
it's very fast paced. I mean, they have those programs though.
But it's what works for you, which is the great thing about nursing. I mean, getting your education and even afterwards. If the 2-year program looks like what you can do and what you're comfortable with, then by all means do it. I mean, all the programs are good. You have to sit for the same state board, the same test. So, I mean, it's not, so they all prepare you the same way. I mean, it's to their benefit to have all their graduates pass the test. And that's one thing when you're looking at schools. You want to look at
their pass
what,
rating.
yes, what percentage of their graduates pass the test, and or like
If it's low, that's not a good thing.
right.
Right.
Then you might want to look at another program.
Yeah.
But I mean, just for your money because you're still paying.
And you have to pay to take the test. It was like
Yeah, that's another
$300 or something like that. So if you take it
for the privilege of taking a
just
test.
to take
How
it,
about
yeah,
that?
and then if you don't pass, then it's like okay, well now I have to pay $300 more and take it again.
Yeah,
But it
So.
sounds like this is a great career, lots of flexibility,
it is.
a lot of job openings that are going to be coming, lots of
Mhm.
ways to go about it, and
Right.
lots of ways to kind of move up to different areas once you get experience. So
And
it sounds
people
like
are living longer now too.
Right,
We're
so-
finding, I don't want to say cures to diseases, but kind of different things to help prolong people's lives so people are staying alive longer. So we need these nurses for,
Yeah, I mean, there's a
Different population.
definite need. You'll definitely have a job when you graduate from school, and it may not be in Pittsburgh, but
Yeah.
but I mean, you'll.
and it may not be your dream job at first. Like I,
Yeah.
know I was worried about, I personally didn't really want to work on like a med surg floor that was just like general medical stuff. But I applied to places and interviewed places and I was just going to go where I could get a job. And I kind of lucked out and got somewhere where I wanted to work.
Yeah.
You know what I mean? So you might have to take a job for a couple of years somewhere where you don't really like, and then you can transfer from that job to another floor in the hospital or something.
Yes.
What was it like to have a nursing interview? I know that's like a weird question to ask, but like,
Yeah.
what do they ask of you?
On your first job, you
Yeah.
mean?
Kind of asked me a lot of, I don't want to say preparedness questions, but a lot of them were like scenarios. Like they
Yeah,
give me
what
a
would you
scenario
do?
And like they'd be like, okay, what would you do? And then I'd have to kind of talk my way through it, or, how, I don't want to say describe yourself, but it was, and that was hard for me because I don't really like talking about myself and saying, oh, I'm organized and I'm this and I'm that. Like I'm not really good at that, but you kind of have to.
Sell yourself.
Yeah, you kind of basically is what it comes down to. You kind of have to think of okay, what am I good at, and kind of be able to verbalize that to the person that's interviewing you.
And a lot of times when you're on rotation in your clinical sites from your schools and you're on these units, for several weeks. So you're working side by side with a lot of these nurses. You work the same schedule as they do, so you get a feel
That's
for
how
it.
I got the job that I
And
had.
then And then so they get to know you, and the staff knows you. And if the staff knows you and likes you and think you'll be a nice addition to their staff, usually before your rotation's over, I mean, they're talking to you. They'll say, make sure you come back and interview with us. Make sure you come and apply. Really, that's how a lot of us get our jobs, because they've seen you work. So it's
I had a transitions rotation at McGee, so I got paired up with a nurse and I worked her schedule whenever I didn't have class, and I had to do 270 hours in a semester, so I was there a lot. And at the end of that, I kind of talked to the unit manager and said, hey, I'd really like to work here. If you have any openings in the spring, I'd love to interview. And I kind of kept in touch with her a little bit, and the people that were there with my preceptor also, like, they kind of put in good words for me. And I actually interviewed and had a job offer before I took my test. So I was hired pending that I passed, which I did, but so sometimes you can kind of get it, like she was saying, you kind of talk to the people that are there, you can almost get something set up.
Yes.
Kind of right out of school.
With a lot of careers, you have like a job before you finish school. How common is that in nursing?
The only thing they wait for you now is to see if you passed your boards.
Yeah.
Before you used to be able to work, but now you have to pass your boards before you can do it.
And I'm not sure if they're still doing this, and I'm only using this school because I know people that have done this, but Penn State Barron has a nursing program. I think they call it like 3-in-1 or something like that, but they went to school for 3 years and got their associate's degree. And they graduated, took their test, the NCLEX, and then they could get a job, and then they went that last year and got their bachelor's degree. So during that last year they were working, but still kind of going to school, but it wasn't like I'm going to go to this school and graduate and then apply back to this school. It was all, like, it was understood that when you graduate, you get your bachelor's, but they kind of broke it up a little bit so that you could work with your associate's degree while going and finishing and getting your bachelor's.
Yeah.
Like I said, other schools might do that. I just know of that school in particular because I know people that did that, so I know that could be an option as well.